Good evening, everyone. Metabolic and nutritional diseases in sheep and goat. So here I have concentrated only regarding the clinical management and purely regarding the practical aspect, how to diagnose a case clinically and how to treat the case. Hypomagnesemia, some cases we will be exhibiting because of the low availability of the magnesium, they will exhibit hypomagnesemia because of reduced absorption of magnesium. When there is increase in the potassium and the calcium in the diet, naturally the animal go for hypomagnesemia. For example, in pregnancy toxemia itself, when you are giving potassium chloride syrup, you should not give in excess. When you give more potassium, that will lead to reduced absorption of magnesium and the animal will start showing signs of nervous signs. That is due to hypomagnesemia. And hypomagnesemia, as I already told, it can induce hypocalcemia. All these things are interrelated. So as a safer method, you can give calcium with magnesium preparations when you are giving. That will take care of all your clinical signs. So grasses which are having low magnesium level, that will also be a predisposing cause for hypomagnesemia. Here the same things like that will be having stiffness, ataxia, and hyperexcitability. The paddling will be there, and the extreme leg stiffness will be there, and the convulsions will be triggered by the external stimuli. When you make the animal like this, when you make the external stimuli, immediately the animal will be having convulsions, and then and that. And stress conditions, transportation, these are the predisposing causes for this hypomagnesemic tetany. So you can use the combined treatment of the magnesium and calcium preparations available, that and all you can use very well safe. So before administering all these things, how to rule out acidosis. So first rule out acidosis, palpate the rumen and see whether there is any fluid splashing sound is there or not. If there is no fluid splashing sound, if the dung is normal in consistency, then you keep your diagnosis differential as hypocalcemia or hypomagnesemia tetany. In hypocalcemia, the tetany won't be there. The animal will be recombinant or lateral recumbency, comatose will say. In hypomagnesemia, conversions will be there. These are all the difference. We can very easily identify these type of cases. Tetanus, very easily you can identify. All the limbs will be very much stiff and the locked jaw will be there. So locked jaw, all the four limbs will be stiff, stiffness of all the four limbs, and the ears will be erected and it cannot be able to bend the neck. So these are all the signs of tetanus. And polioexodementia, I will show the clinical signs. We can give the magnesium infusions. Magnesium or calcium combined infusions can be given either IV and followed by subcutaneous. And oral magnesium oxide or magnesium sulfate can be used for preventing the recurrence.